Have you ever stopped to think about how truly wild it is that we can see and hear? I mean, we're constantly using these two incredible pieces of biological tech, our eyes and our ears. Today, we're going to take a tour of how they manage to turn simple things like light and vibrations into the world we experience every day. And, we'll even do a little troubleshooting for when the system gets, well, a few glitches.
So here's the plan. First, we're going to dive into the user's manual for our eyes, how they actually work. Then, we'll flip to the troubleshooting section for some common vision problems. After that, we'll do the exact same thing for our ears. First the mechanics, and then what happens when that signal gets lost. Let's get right into it.
All right, let's kick things off with vision. Honestly, the best way to wrap your head around the eye is to think of it as this super advanced, living camera. It's got a lens, an autofocus, a sensor screen, the whole package, all working in perfect harmony.
But how does that actually happen? How does a simple ray of light bouncing off, say, a coffee cup and zipping into your eye become the image of a coffee cup in your brain? It all happens faster than you can blink, and it is just mind-blowingly cool.
Okay, so the journey starts right at the front. Light passes through the cornea, which is basically the eye's transparent windshield. From there, it hits the lens. This is the autofocus part. It bends the light, aiming to get it perfectly focused onto the retina, way at the back of the eye. And that retina? That's our sensor screen, the part that actually converts light into an electrical signal the brain can understand.
Now, if we zoom in on that retina, that sensor screen, it's packed with these two amazing types of cells. You've got your rods, which are the absolute masters of night vision. They pick up dim light and movement in your periphery. And then you have the cones, which handle all the bright light, give us our sharp, detailed central vision, and of course, let us see the world in brilliant color.
So of course, like any piece of high-tech gear, this living camera can have its glitches. Now that we've got the basics of how it works down, let's open up the troubleshooting guide for a few common vision problems.
The most common issues by far are these focus glitches. Here's the deal. If your eyeball is a little too long, the light focuses in front of the retina. That's myopia, or what we all call nearsightedness. If the eyeball is a bit too short, the light wants to focus behind the retina, and that's hyperopia, or farsightedness. This is exactly why glasses work. A concave lens spreads the light out for myopia, and a convex lens pulls it together for hyperopia, putting the focus right back where it belongs. All right, next up, a clarity glitch. This one's called a cataract. It's simply when the lens of the eye, which are supposed to be crystal clear, starts to get cloudy and opaque as we age. The analogy is perfect. It's just like trying to take a picture through a smudged, foggy camera lens. Everything just gets progressively blurrier.
Now, the fix for this is incredibly elegant. In a procedure with a very long name, phacoemulsification, a surgeon uses this tiny ultrasonic device to basically liquefy the cloudy old lens, vacuums it out, and then slides in a brand new, perfectly clear artificial lens. It's pretty amazing.
Okay, let's talk about a pressure glitch. Glaucoma is, for all intents and purposes, a plumbing problem inside your eye. There's this fluid called aqueous humor that's supposed to drain out, but if it gets congested, pressure starts to build up. This pressure can then seriously damage the optic nerve, which is the all-important cable that connects your eye to your brain.
And to put a number on it, a normal, healthy eye usually has a pressure somewhere between 10 and 21 millimeters of mercury. With glaucoma, that number starts to climb. But the really scary part? It usually does it without any symptoms at all, at least not at first.
Now, it's absolutely crucial to know that this glitch comes in two main flavors. Open angle is the slow, silent one. It's about 90% of all cases. The pressure builds up gradually, and one of the first signs is losing your peripheral vision, that classic tunnel vision. Closed angle, on the other hand, is a full-blown medical emergency. It comes on fast, it's painful, and a major red flag is seeing halos around lights. Let's move on to a sensor glitch, retinal detachment. And yep, it's exactly what it sounds like. That critical sensor screen, the retina, actually starts to peel away from the back wall of the eye. This is a big one, a true medical emergency that needs immediate attention.
The warning signs here are pretty distinct, and you need to know them. A sudden shower of floaters, those little specks floating around your vision. Flashes of light, and the most critical one, a feeling like a dark curtain or a veil is being pulled over your field of vision.
And finally, for the eyes, we have macular degeneration, which is a glitch right in the center of your vision. The dry type is a slow burn. Yellow deposits, called drusen, build up, and people often say it feels like pieces of their vision are missing. The wet type is much more sudden. Abnormal blood vessels start to leak fluid, and a classic sign is that straight lines suddenly look wavy or crooked.
Okay, let's switch gears. We're done with light waves, now let's talk about sound waves. Our hearing system is just another marvel of biological engineering, perfectly designed to catch, amplify, and translate vibrations into the sounds that make up our world.
So a sound's journey starts in the outer ear. Your auricle, the part you can see, acts like a satellite dish, collecting the sound. Then the vibrations head to the middle ear, where they get amplified by 3 of the tiniest bones in your body. Finally, they hit the inner ear. And this is where the magic happens. A tiny snail-shaped structure called the cochlea translates those mechanical vibrations into electrical signals the brain can actually process as sound.
And you guessed it, just like our vision, our hearing can have glitches too. Usually, it's because that sound signal gets blocked, muffled, or just misinterpreted somewhere along that incredible pathway we just traced.
Some of the most common problems are actually pretty simple. You can have a straightforward blockage from earwax, impacted ceramin, or an infection in the outer ear canal, otitis externa, which everyone knows as swimmer's ear. And then a little deeper in, you can get a middle ear infection, otitis media, which is what often causes a painful, bulging eardrum.
Now, hearing loss itself usually falls into 2 big buckets. Conductive loss is a physical problem, like a blockage in the outer or middle ear. Sensorineural loss is a nerve issue happening in the inner ear. But check this out, this is fascinating. People with conductive loss often hear better in noisy rooms because everyone starts talking louder to overcome the background noise. For people with sensorineural loss, though, that extra noise just makes everything a jumbled mess.
So how do you tell which is which? Well, doctors have these brilliantly simple tuning fork tests. For the Weber test, they put a vibrating fork on the top of your head. If you have conductive loss, the sound actually seems louder in your bad ear. Kind of weird, right? With sensorineural loss, it's louder in the good ear. And the Rene test helps narrow it down even more by comparing sound through the air versus through the bone.
Hey, remember glaucoma from earlier, the fluid pressure problem in the eye? Well, you can think of Meniere's disease as the glaucoma of the ear. It's caused by an abnormal buildup of fluid inside the inner ear, and it completely throws off the delicate systems that control not just our hearing, but also our balance.
And what this fluid buildup creates is just this debilitating triad of symptoms. People get hit with these sudden attacks of severe, spinning vertigo, a roaring sound or ringing in the ear called tinnitus, and hearing that can come and go. It's a really tough condition that can shake a person's entire sense of stability.
Seeing a sunset or hearing your favorite song, that all feels so effortless, doesn't it? But as we've just seen, those experiences are the final product of these breathtakingly delicate and complex systems. So I guess the final question is, what changes for us when we stop just taking it all for granted and start to truly appreciate the absolute wonder of how we perceive the world?